So dear students, in this video, now we are going to discuss the dosage forms. Now dosage forms is a very important part of understanding the drugs. So here we'll be studying about the solid dosage forms, in which we have powder, tablets, capsules, lozenges, suppositories. Then we have the liquid dosage forms, in which we study about solutions, suspension, elixir, syrups, linctures, drops, lotions and injections. Then we have semi-solid dosage forms, where we study about ointment, cream, paste and gels. And then we have inhalational substances, which are gases or volatile liquids, which are administered by inhalers or by hood or face mask or endotracheal tube. Anesthetics are given by that route. And we have the instruments through which these drugs are delivered are MDI, that is meter dose inhaler, pressurized meter dose inhalers. Then we have rotahalers, we have jet nebulizers. So the main aim of studying about dosage forms is to understand what dosage forms are, why they are needed, classification, and their advantages and disadvantages, right? So let's see them one by one. So now we understand, first of all, what is a dosage form, right? So what exactly is a dosage form? Now a dosage form is basically the form in which the drug is prepared and given to the patient for administration, right? So a dosage form necessarily is basically the form in which the drug is delivered to the patient. Now the drug, a dosage form will consist of the active ingredient, that is the drug, right? And it will also consist of some inert substances. These inert substances can be excipients, can be diluents, can be preservatives, or can be just a vehicle, right? So these are important or they impart color, a specific color, or they mask the bitter taste of the drug, or they just give a shape and to basically maintain that particular dosage form. So these are the inert substances which are added with the drug, right? Now these substances, they, as I told you, they make the drug stable, effective and palatable. Now second thing is, why do we need them? Why do we need a dosage form? Why can't we just take a drug like that? Now a dosage form is required. Basically, the first important thing that is there is to ensure accurate dose. So suppose we say that this dosage form is 500 milligram, this tablet is 500 milligram. So we have an accuracy of the dose there, that okay, we are delivering 500 milligram. The second is to protect the main drug, the active drug, from external factors. Like, what are the external factors that can damage the drug? It can be sun, it can be heat, it can be moisture, right? All these things, acid, or maybe just coming in contact with the outside air. Then to mask the color or odor if it is unpleasant, which is unpleasant, right? So for that we need. Then to control the site and the amount of drug release. So sometimes some dosage forms are basically made as sustained release or controlled release. So why they are like that? Because they control the rate and the amount and the site of drug release. Then to make the administration easy, simple, and also acceptable to the patients. Sometimes the patient may say that if something can be given by injection and then something can be given by a drug, so it will be easy to give an oral medication is easier to give, to improve the stability of the drug, and or what I can say is to improve the shelf life, sorry. Then to enhance the absorption at specific sites. We want certain specific sites to be more effective, the drug to be more effective in those sites. So in that case, these dosage forms are very helpful. Now coming to the first dosage form, that is the solid dosage forms, right? Now in solid dosage forms, the first dosage form that we have is powder. Now powder means it is basically a dry, finely powdered drug form, right? Now this can be used internally also and externally also. For example, for internal use, we have something called as ORS, which is oral rehydration solution. Now oral rehydration solution is something which is used in diarrhea, right? Now externally, we have some topical application powders are there. then which can be like antibiotics. So if there is some wound, then you can just dust that powder there, antibiotic will go. Or we can have sprinklers, or we can have dusting powders, right? So we have powders for external as well as internal use. Now, what are the advantages? So if it is a powder, what is the advantage? Advantage is that it is easily absorbed, then flexible dosing, right? And it is suitable for heat stable drugs. You can use heat stable drugs only as powders. Now, what are the disadvantages? Disadvantages are, suppose a powder is to be eaten, so unpleasant taste will be there. Unpleasant taste will be difficult to mask in a powder. Then it may be inconvenient to carry and dosing. So that these are some factors associated with powders, advantages, disadvantages, and this is the main thing about the powders. Now, next dosage form that we move on to is called as tablets. Now, tablets are most common dosage forms, right? We all have eaten tablets, so it is the most common dosage form. And what is tablet actually? Tablet is nothing but a compressed form of powdered drug. So the drug powder is basically compressed in the manufacturing company, in the manufacturing industry, and it is compressed into a tablet form. And it has excipients also, so that stability and other features are there. A tablet can be plain, or it can be sugar coated, or it can be film coated also. Okay. Then there are various types of tablets. So let's see what are the various types of tablets. So we have chewable tablets. Chewable tablets means the tablet can be chewed in the mouth and then it can be swallowed. So it has to be tasty. It has to be tasty so that the patient will chew it. Then we have dispersible tablets. What does dispersible means? That in water, when you put the tablet, it disperses and then solution is gulped or drunk, right? Then we have sublingual tablets. Sublingual tablets means tablets which are put under the tongue. You put the tablet under the tongue and then it is absorbed from the buccal mucosa. Now, here you should remember one thing, that when you give a sublingual tablet and it is absorbed from buccal mucosa, then it bypasses the first pass metabolism. This is a concept which we will study in pharmacokinetics. So a drug given by sublingual route will bypass the first pass metabolism. So when you want a fast action, then you put the tablet under the tongue. Then we have enteric coated tablet. What is enteric coated? Enteric coated means it is coated with a material, so it basically dissolves in the duodenum and not in the stomach, right? So this is the enteric coated tablet. So it passes through the stomach, does not dissolve with the acidic medium of the stomach, and dissolves finally in the duodenum. Then the next tablet that we have is sustained release or extended release tablet. Now these are coated with a polymer, so that it dissolves finally in the ileum, and or gets absorbed, it gets absorbed over a prolonged period of time. So it does not get absorbed immediately, and sometimes the absorption period can be as long as 12 hours also. Then we have controlled release tablet. Now controlled release tablet means, again, there's a prolongation of the duration of action, and the release is controlled. How it is controlled? It is controlled with a semi-permeable membrane. Okay. So we have chewable, dispersible, sublingual, enteric coated, sustained release or extended release, controlled release. Then we have drugs which are also called as effervescent. So effervescent tablets are there. Effervescent means that they contain sodium bicarbonate and some organic acid like tartar, and so that when it is added to water, then it releases carbon dioxide. The very common example you all must have seen is ENO that you use in the house. So this consists tartaric acid, and this, when you dissolve it in water, it releases carbon dioxide and disperses and dissolves the active ingredient, right? So these are the various types of tablets. Now what is the next dosage form in solid? That is capsules. Now capsules, what are capsules? You all have seen capsules. These are basically cylindrical water soluble containers. Okay, cylindrical water soluble containers. They are made of gelatin so that it is easily dissolving when you take it with water, and they are usually filled with either liquid or powdered medications. Now capsules are of two types. They can be either liquid filled or they can be powdered filled. Liquid filled, you all must have seen gel like capsules, like gel or what you call as bilkul semi solid or soft capsules. They usually consist of liquid, and powdered mein we have usually enteric coated capsules. Why do we have a capsule? Why are we using a capsule? Because we want the drug to basically dissolve on reaching the ileum, right? So when we want the drug to reach the ileum, that is why we are putting them inside a shell, and we don't want it to be dissolved in the stomach by the acid. So these are the different type of capsules we have. Then there is one more thing which we should know, which is called as spansule. Spansules are basically extended release capsules which are packed with granules with coating for release over a period of time. Like all the particles will not release together. Some will release first, some will release afterwards. So this way you have a extended release capsule. So now what is the advantage? Now advantage of this capsule is that first of all it masks the taste and the odor. It is very important because the things that you are eating are usually very bitter. Usually the things which are given, then rapid drug release is available, then they're easy to swallow because they are coated so the person doesn't even realize the taste or the odor as compared to the tablets. Now what are the disadvantages? Disadvantages that they are costly. They're always costly as compared to the drugs. They are sensitive to temperature and humidity because the gelatin capsule is sensitive, and so in humidity or in high temperature they can even get dissolved or they can just disintegrate. So these are the capsules. The fourth dosage form in oral dosage form is lozenges. Now what are lozenges? Lozenges are basically sweet flavored shapes for slow dissolution in the mouth. For example, we have throat lozenges, and all of you must have in your lifetime eaten Vicks or Strepsils. So these are the lozenges. You don't chew them, you actually just slowly they dissolve in your mouth and then they release a drug which goes in your throat and gives a soothing effect. So like throat lozenges are there. What are the advantages? Advantages are that they are they have a local soothing effect. So it is something that a drug, a tablet which you are taking, a medication you are taking may not give a local soothing effect. No, suppose you take an antihistaminic for cough or for allergic rhinitis or allergic pharyngitis, it will reduce the symptoms, but for local soothing effect you would like to have something like this. What is the disadvantage? That they are not, this particular thing cannot be used for systemic drugs. Secondly, as they are very sugary, so they are not very good useful for diabetic patients. They cannot take it very frequently, right? So now the next drug dosage form is suppositories. Now what are suppositories? Suppositories are basically conical bullet shapes. They are used for insertion in the anal canal. So they are given by the anal or the rectal route, what you call as rectal or anal, or they can be even given by the vaginal route. Right, now these drugs, when they come in the contact with body, they melt at the body temperature and they release the drug. And these drugs, they are very fast absorbed, just like you keep something sublingually and it gets absorbed very fast and it bypasses the first pass metabolism. So this route also bypasses the first pass metabolism. Okay, now where should we give it? It is very useful in unconscious patient, or if the patient is causing repeated vomiting and cannot sustain anything orally. So that is the this is the route which is given. So that is the advantage. Now what is the disadvantage? That it is uncomfortable and painful, right? To insert something anally or rectally or vaginally can be painful. Plus the absorption is variable. So this is not a very a route where you can say by confirmation that okay, this is the dose that I have given, right? Now coming to the liquid dosage forms. So in liquid dosage forms, the first thing that we have is called as a solution, right? Now what is a solution? A solution is basically a drug, sorry, it is a drug which is dissolved in water and it is taken orally. It can also be taken topically, right? It can also be taken parenterally, like normal saline, dextrose, normal saline. They are all solutions. What is the advantage? Advantage is that it is rapidly absorbed. Rapidly absorption is there. Then it is easy to swallow, and it is very easy with the small children. With the children and elderly, you can give it very easily. What is the disadvantage? That it has got a very short shelf life. You cannot keep a liquid solution for a long time, and it usually requires preservatives. So this is a solution. Now next we have in the liquids, we have is suspension. So what is a suspension? Now as you all have studied chemistry, so you know that a solution is basically when the drug remains dissolved in water, and a suspension is when there are insoluble particles. Insoluble drug particles are there which are dispersed in a liquid medium, and here in a suspension usually they remain separate, both the mediums. You must have heard of emulsions. Emulsion is something where basically two insoluble or immiscible liquids are suspended, are mixed together, right? And usually in them one is oil and one is water. So it is either oil in water type of suspension, or it is water in oil type of suspension. Now as you know, milk is a naturally occurring suspension, emulsion. This also you know. Now a very important disadvantage I'll take first is that they settle down on long keeping. So whenever you use a suspension, you have to shake it before use, and that is why you will see on a lot of bottles of suspensions, you will see that it's written shake before use, right? It should be thoroughly shaken. What are the advantages? Advantages are that it is good for insoluble drugs which cannot be mixed in water, and they usually again have some excipients or preservatives to mask the unpleasant taste of the drug. So it is either very sweet and very flavored drug, right? So this is all about suspension. Next we have is elixir. Now what is an elixir? Elixirs are basically hydroalcoholic solutions of drugs. They are usually sweetened and flavored. So these are elixirs. So in this we have two types. One is called as a syrup. Syrups are very high concentration of sugar, and they are thick also in consistency. So drugs which usually deteriorate in aqueous medium, they can also be given as a dry syrup. You must have seen some antibiotics for children. They are given as dry syrups, and in them we have to reconstitute them by mixing or by adding water. So if any of you have small brothers or sisters at home, you can see that if they develop cough or allergic rhinitis, pharyngitis, then the doctor gives them some bottle, and in that a dry powder of that antibiotic is there, which is reconstituted by adding water, and then it is kept in controlled temperature. It is always kept in the fridge and to be used in 3 to 4 days. It is not to be for a long time. And here again, so one is syrup. Second that we have is linctus. Now what is a linctus? Linctus is basically a viscous syrup. Means it has to be licked slowly for soothing the throat, right? So it is licked slowly for soothing the throat, and usually it has got also menthol for the cooling sensation. So it is usually many antitussives you will find that they are linctuses. So this is basically elixir. Now coming to the next liquid dosage form, that is drops. Now drops are very commonly seen dosage forms. For external use, we have seen eye drops, we have seen ENT, ear drops are there, then nose canal drops are there, right? So even for oral ingestion also, sometimes drops are given to the patients or children, like polio drops are there. So these are drops. They are good for infants, they are good for young children. They are given medicines with the help of a dropper only, because it is easy to take it. Then Antibiotics, they can be given by whenever there is an infection in the ear, nose or throat, then antibiotics, and even painkillers, they can be given by drops. Okay, so they have a nozzle, they have a dropper for accurate dosing, and that is how it has to be given. Then in we have lotions also. Now what are lotions? Lotions are basically solutions. They can be solutions, they can be suspension, they can be emulsion, and they are always externally applied. So external application and without rubbing. They are just to be applied without rubbing. So what is their use? They have a cooling and a soothing effect, right? And they are usually protective also. So they have a protective or emollient effect. And there is one more thing, liniment. Liniment, you will see, it is a dosage form in which is usually made for counter irritants. They are rubbed on the skin to relieve the pain. For example, if you have headache, then there is this headache balm which is coming and which is used and rubbed on the skin to produce a counter irritant effect or rubefaction. So that is, lotion is not rubbed and liniment is always rubbed on the skin. Then in liquid dosage forms, the last dosage form that we have is injection. So injections are given. These are basically sterile solutions or suspensions in aqueous or oily medium. Okay, and they are used either for subcutaneous or intramuscular injections. In IV, we use only aqueous. Please remember this. In IV, we use only aqueous. No suspensions are used in IV injections, right? Because what can happen, because these particles which are there in the suspensions, they can cause embolism. They can, if they're injected IV, then they can cause embolism, right? So however, some drugs, for example, TPN or propofol, or drugs like amphotericin B, they are usually injected IV and they are suspensions or emulsions. Okay. Then some drugs which are basically they are given in dry powder form when some drugs are basically unstable in aqueous solution, so they are reconstituted at the time of application. Then pre-filled syringes are also available with some drugs, for example insulin, and they are also injected IV. Then IV infusions, they come in either glass or they come in polypropylene bottles. So these are the IV, these are the substances which are given by the IV route, and they are liquid dosage forms. Coming to the next dosage form that we have is called as a semi-solid dosage form. Now in this we have four types: ointment, cream, paste and gel. Now understand the difference between all the three. Ointment is very important to understand. Ointment is greasy. Cream is basically the base is water in oil, so it is not so greasy, right? It is better absorbed from the skin than from an ointment. Then paste is basically a non-greasy preparation, absolutely non-greasy. They are basically hydrophilic preparations, and gels are basically a viscous colloidal solution of gelatin, right? And so now let's come to the different type. What are their understanding, advantages, disadvantage? Now, so ointment, if we talk about ointment, they are greasy. They are used for external application only, external application, and they are used on chronic dry lesions. They are not used on oozing or bleeding surfaces, right? So this is the specific feature of ointment. They are sticky, they are uncomfortable, right? So this is the feature of ointment. Now a cream is basically water and oil emulsion. It is better absorbed because it is hydrophilic, more water content is there, so it is better absorbed from the skin, and it is cosmetically more acceptable than an ointment. So you must have seen a lot of creams also which are being used. Coming to the paste. Now paste is basically a thick semi-solid thing having more of solid and less of liquid. Now paste are usually having hydrophilic content, such as they have starch, or they have aluminium or magnesium hydroxide or zinc oxide or carboxymethyl cellulose. These are there. Then they may also have glycerol, or they may have propylene glycol. For example, we have toothpaste, which we very commonly use, and then toothpaste which are medicated also, having some drugs added to it. So these are paste. Okay, then gel. Now what is the gel? They are viscous colloid solutions. They are used externally on the skin, and they can be used on the ulcers. They can be used on cuts, on oozing surfaces also. They remain for a longer time there, and as compared to the aqueous solutions. So these gels, they remain for a longer time. For example, you must see there is this neomycin gel, soframycin, which we very commonly use on cuts and any other oozing surface, we use it. We have inhalational agents. In inhalational agents, we have meter dose inhalers, we have rotahalers, right? And we have nebulizers also. So now let us understand them, that meter dose inhalers, or also pressurized meter dose inhalers, they are basically handheld devices, okay, and they use a propellant, for example, which is hydrofluoroalkane. So it delivers a specific dose of the drug is delivered in the aerosol form, and we will study about them when we will study about the drugs which are used in the treatment of asthma. Then nebulizers, they produce a mist of the drug solution generated by pressurized oxygen or air, right? Then this is basically a jet nebulizer, and if we have ultrasonic nebulizers also, and they use electrically vibrated crystals to produce the mist. So they are nebulizers. Then rotahalers are again, they are also portable devices, and they use a capsule, or what we call as a rota cap, and it consists of a very finely powdered drug inside it, and then they are aerosolized by the inspiratory airflow of the patient. So this is the difference. A meter dose inhaler has a propellant, so it delivers a specific dose in aerosol. A rotahaler has got finely powdered drug in a capsule, rotacap, and it is aerosolized by the inspiratory airflow of the patient. And nebulizers, usually they produce a mist, and this mist is then delivered either by pressurized oxygen as a jet or by ultrasonic system. So coming to the advantages and disadvantages. So what is the advantage of a meter dose inhaler? So a meter dose inhaler, the first advantage is that it is compact and it is portable, right? Then it has got a quick onset of action. There is no risk of any contamination from outside agencies. Dose can be regulated, and less adverse effects, because systemic adverse effects are less, because the dose which is used is not very high. But what are the disadvantages of meter dose inhalers? The first one is that it is expensive. There is a risk of local irritation. Then there may be a poor hand, breath coordination, which may result in inadequate drug delivery. A lot of dose can be wasted by the drug depositing in the oropharyngeal mucosa, and it contains propellant which can be harmful, right? Now in this, something very important which you should know and remember always is that very important for MCQ point of view also, that efficacy of the drug depends upon the particle size. So 1 to 5 micrometer diameter particle, they reach the bronchioles and deliver the drug effectively, right? So 1 to 5 micrometer diameter particles. Less than 1 micrometer particles do not settle anywhere and are exhaled out, while more than 5 micrometer particles settle on the oropharynx. So again, they are causing adverse effect of candidiasis, that is oropharyngeal infection, fungal infection in the oropharyngeal mucosa. So this was about the various dosage forms. In the next class, we'll study about the drug delivery systems and then the route of administration.